When a tooth is lost, bone is lost with it. So the whole of the tooth-bearing part of the jaw is developed by the teeth. So the tooth goes, the supporting bone goes. And when a tooth is being replaced, the first thing that we want to do is not lose the bone in the first place. So if a tooth is being removed, ideally, we want to be able to retain what bone there is around it and not lose it. So the first idea is to maintain what's there. But if it has been lost due to an abscess or due to bone infection or whatever is lost, caused loss of the tooth, gum disease, you will need to have sufficient bone volume. Now, the bone volume is for two things. First of all, you need bone volume to be able to actually put the implant in. You need enough bone to support an implant. It doesn't need to be much, interestingly. You can get away with reasonably little bone and use shorter implants, for example. But more importantly than the actual support is the long-term stability of the tissue around the implant. If you put an implant into too little bone, over time with function, what tends to happen is that bone tends to remodel and get thinner, and you also get recession around the implant and the soft tissue follows the bone. And you also then end up with the implant becoming exposed or unsightly. So the bone is there to act as support, but there needs to be enough of it for it not to shrink over time. It needs to be stable over time. So bone augmentation is really to set the frame in which a tooth will function, or an implant will function over time. And the more bone you have, the better the final result tends to be, the more stable the final result tends to be, and the more live bone there is around the implant, the better the implant will function. Bone augmentation is an integral part of virtually every implant. It's very rare that you get to place an implant into a site and not add some level of bone, even if it's a little bit. It has long-term benefits. So if you don't have adequate bone for placing an implant or for the shape of gum that you require around the tooth so that it looks natural, you'll need to augment gum and bone. So it's not just the bone underneath, it's not just the bone housing, it's also the soft tissue on top. So when an implant goes in, it's not just about placing the implant, it's also about making sure that there is sufficient volume of bone around it in every dimension, in 3 dimensions. And this also follows with the soft tissue on top. Otherwise, the implant will not look natural. Anyone, as long as their medical history allows them to have surgery and they are not taking any drugs that affect bone metabolism, such as bisphosphonates, then anyone can have bone augmentation. And the bone augmentation can be carried out. There are several different ways of doing it, but most people who require dental implants will require some level of bone augmentation. Well, during, it's not painful at all, you're numb. Afterwards, nothing much actually. Most people find that there's not much difference in the level of discomfort you get after a tooth extraction or an implant placement or bone grafting. It's quite gentle surgery. It sounds pretty horrendous, but actually it has to be gentle because you have to respect the tissues to get the best result. So it's actually quite gentle surgery. And the idea is that you're creating volume. And very often you're placing proprietary products into the bone housing rather than having to go elsewhere in the patient's body. We're doing less and less cases where we are having to take bone from the patient themselves. Mostly it is manufactured bone, either from animals or synthetic, that allows us to reconstruct bone. The recovery after the surgery is just like any other surgery. It will take a couple of weeks for the tissues to heal fully over so that you're comfortable enough to function. But the bone itself will take anything from 6 months to a year to mature fully. So bone heals slowly, and one of the things that you mustn't underestimate is how long it takes to get a good, stable result. If you go in too early, if you try to put an implant into a graft too early, or if you try to load an implant too early that's been placed in grafted bone, the level of failure will go up. So you need